Hi everyone, this is Celina Nahyun Jo, one of the trainee editorial board members in Radiology Imaging Cancer. I'm a radiology resident at University of Texas Medical Branch at Galveston. Bite-sized research is a short summary of interesting articles in the latest issue of Radiology Imaging Cancer Journal. This podcast provides background knowledge for everyone to understand and enjoy oncologic imaging research on the go. This is bite-sized research for Radiology Imaging Cancer, November 2023 issue. Today's article is a review article called Current Status of Cancer Genomics and Imaging Phenotypes, What Radiologists Need to Know. The first author is Dr. Eva Mendez-Serrao, and senior author is Dr. Xiaoyang Liu. Cancer research has made significant progress thanks to recent discoveries in genomics and epigenomics. These advancements have improved clinical oncology and precision healthcare by providing insights into the biology of tumors and their differences among patients. Large-scale genomic sequences has led to new tumor classifications, biomarkers, and targeted therapies. Radiologists play a crucial role in cancer diagnosis and therapy, and it is essential for us to understand the basic concepts of genomics that have now become a part of oncology clinical practice, so we can make imaging interpretation more precise and meaningful. So, what is epigenomics and genomics? The authors start the article by explaining the basic terminology. Imagine the DNA transcription process diagram in a biology textbook, and we're going from the periphery to the center of the diagram. Epigenomics is an analysis of methylation and acetylation of the DNA or histones to understand reversible modification, which alters gene expression without the actual change in DNA sequences. Genomics is a DNA sequencing to understand any mutation or alterations in the DNA. Transcriptomics and proteomics consider the entire cellular messenger RNA or protein composition. The technologies include RNA sequencing, microarray, or mass spectrometry. Cancer is basically a mutated cell that continues to proliferate and avoids cell death. Cancer can be broadly classified into hereditary versus sporadic. Even if the cancer is hereditary, which means there is a germline mutation inherited from one of the parents, it only occurs in a characteristic organ. This means that the local environment regulates the tumorigenesis. The sporadic form is more common. This is DNA mutation that is acquired during the individual's lifetime through DNA replication error or exposure to carcinogens. Current sequencing technologies offer characterization of whole genome, genomics, methylation profiling, epigenomics, and mRNA sequencing, transcriptomics. These can focus on primary or metastatic cells, but also circulating tumor cells. Sequencing cell-free circulating DNA in the plasma provides so-called liquid biopsy and helps identify mutation, treatment response, or recurrence. This review article discusses the fundamentals of genomics and epigenomics, the most common genetic alterations in cancer, and how they affect imaging, organized by different types of cancer. This includes brain, lung, breast, liver, colorectal, neuroendocrine, renal, and bladder cancers. On this bite-sized research podcast, I'll summarize two of those. First is glioma, which is the most common primary brain tumor. The Cancer Genome Atlas Research Network and 2016 WHO classification revolutionized the diagnosis and classification of gliomas by using genomic, epigenomic, and molecular profiles. The Cancer Genome Atlas is an open access data that provides clinical, genomic, epigenomic, and molecular profiles of glioblastoma with corresponding imaging data in the Cancer Imaging Archive. The visually accessible Rembrandt images, or Vasari project, analyze 24 semantic imaging observations, MRI against clinical genomic features. This study provides radiogenomic features of the molecular markers of gliomas. Let's start with IDH. IDH is short form for isocitrate dehydrogenase. Mutant IDH or wild type IDH12 generates oncometabolites that competes and inhibits DNA methylation, which in turn leads to aberrant gene expressions and oncogenesis. All patients with glioblastoma undergo genetic testing for IDH. Patients with glioblastomas with mutant IDH shows better survival than those with wild-type IDH12 tumors. IDH mutant glioblastoma commonly occurs in the frontal lobe or subventricular region of the lateral ventricles. On the other hand, IDH wild type preferentially arise from subcortical white matter. IDH mutant glioblastoma demonstrates an indistinct border, cortical involvement, less edema, less enhancement. Mean ADC value are higher in IDH mutants compared to IDH wild type. IDH wild types exhibit marked peripheral enhancement, central necrosis, and substantial vasogenic edema. The authors provide nice comparison image on the article, so please check it on the original article. Moving on to 1p19q codeletion, which is related to migration, apoptosis, and cell cycle regulation. It indicates low-grade gliomas supporting the diagnosis of oligodendroglial tumor. These patients have good survival and treatment responses. If associated with IDH mutations, the survival rate is even higher. MGMT is a DNA repair enzyme. Methylation of the promoter region of the MGMT gene decreases the cancer DNA repair following cytotoxic chemotherapy. MGMT methylation frequently occurs with IDH mutations and implicates better prognosis. Amplification and mutation of EGFR occurs more commonly in primary glioblastoma and indicate rapid cellular proliferation with poor prognosis. EGFR mutant tumors most frequently localized to the left temporal lobe demonstrate complete enhancement or incomplete ring enhancement and show increased perfusion. Histone H3 K27M mutation causes epigenetic changes and is newly defined in WHO Group 4 diffuse gliomas and correlates with poor prognosis. K27M mutation mimics gliomatosis cerebri and predominantly involves central or midline locations like brainstem, thalamus, and spine. It shows partial to no peripheral enhancement, and these tumors are commonly solid with mild diffusion restriction. Now, moving on to breast cancer. Genetic mutations driving breast cancer can be somatic, such as TP53 or RB, or inherited germline mutations, such as BRCA1 or BRCA2. BRCA1 is one of the most common tumor suppressor gene mutations, with an 80% lifetime risk of breast cancer and 50% of ovarian cancer, and it is also involved with other cancers such as pancreatic, prostate, and peritoneal malignancies. Identifying BRCA mutation not only helps risk stratification, but also confers susceptibility to targeted therapies such as olaparib and a better response to immunotherapy. Clinical guidelines categorize breast cancer based on expression of PR, HER2 hormone receptors, and distinct molecular and genetic profiles. The authors provide a table of subgroups of clinical implications and imaging findings. The subtypes include luminal A, luminal B, HER2 positive, and basal like subtypes. The luminal A and luminal B subtypes of the breast cancer are both ER positive. Patients with these subtypes receive targeted anti-estrogen therapies such as tamoxifen. Selective ER degraders like fulvestrant or aromatase inhibitors including anastrozole or letrozole. Luminal A tumors are usually less than 2 cm in size and have irregular shapes, spiculated margins, clustered calcifications, and lack of peritumoral enhancement on MRI. Luminal B tumors, on the other hand, exhibit irregular, non-circumscribed margins, skin or nipple extension in mammography, and lower ADC values on MRI. Anti-HER2 therapies improve survival in the HER2 positive subtype. Imaging findings include irregular round shape, high ADC values, peritumoral edema, and persistent inflow type enhancement on delayed MR images. Branching fine linear calcifications, microcalcifications, and increased breast density occur commonly in HER2 overexpression tumors. Basal cell or triple negative breast cancer patients have a poorer prognosis with higher metastasis. Checkpoint inhibitor immunotherapy and ADP ribose polymerase inhibitors are the only targeted therapies. Conventional chemotherapy is the mainstay of the care. BRCA mutations are common in basal like or triple negative tumors. These frequently present as round or oval, well circumscribed lesions with smooth margins and no calcifications. On MRI, this subtype commonly shows high T2 signal intensity, rim enhancement, high ADC value, and peritumoral edema. We hope that this short introduction helped you to understand the impact of epigenetics and genetics in cancer imaging. In this podcast, we have only introduced you to 2 types of cancer, but the authors also reviewed lung, liver, colorectal, neuroendocrine, renal, and bladder cancers. They also provide great representative images with diagrams. Please check out the original article for more information. Thank you for tuning in. This was Bite Size Research for Radiology Imaging Cancer, November 2023 issue. And I am Celina Nahyun Jo. See you again.